Good morning. I am Suzanne Lawson with Constellation Consulting, and we are pleased to present the 2020 New Mexico Summit on Health Equity virtual series. This series is funded by the New Mexico Department of Health Tobacco Use Prevention and Control Program and will take place each Thursday through June 25th. For more information about the summit and our upcoming presentations, please visit our website at nmhealthequity.org. While originally intended to be an in-person summit to address health equity within the live, work, play model, the 2020 New Mexico Summit on Health Equity became a virtual series this year due to COVID-19. We appreciate the efforts of everyone involved in transitioning this event online, including our presenters, the Department of Health, Alliance Audiovisual, and the members of our Constellation Consulting team. For security reasons, for today's session, we are utilizing the Zoom webinar feature, and attendees' webcams and microphones have been disabled. If you would like to introduce yourself and engage with other attendees today, please feel free to do so in the chat feature. If you have a question for today's presenter, please use the Q&A function, and we will address as many questions as time allows throughout the presentation and at the end of the presentation. Any materials provided by today's presenter will be posted on our website. You can also access a recording of today's presentation along with recordings of our past sessions at nmhealthequity.org. Following today's session, you will receive an email with a link to an online evaluation. We encourage everyone to take the evaluation. If you would also like to receive community health worker or social worker CEUs or continuing medical education units, you must complete the evaluation. CEU certificates will be emailed out within 30 days of completion of the evaluation. This year, we are excited to offer you an additional way to engage and connect with others participating in this year's Summit on Health Equity virtual series. As an illustration of our continued growth as a community, we invite you to participate in our virtual mosaic. This mosaic will be built over the next several weeks and will be made up of photos you send in to us. You can send in one photo or several. They can be of you with those that you may be with during this time, or even images that you find that are inspired by this week's presentation. To be a part of this, please send your pictures and images via email to info@constellationnm.com with the subject Mosaic. The Mosaic is currently live at nmhealthequity.org, and we will continue adding photos each week. And finally, before we begin today, on behalf of Constellation Consulting, racism has no place in our communities. We are New Mexico, and we were built strong by the diverse people of our communities. There are a variety of organizations supporting health equity and equity in general throughout our state. We have listed just a few here and encourage each of you to seek out, learn more, become involved with, and support organizations who are building a better world for us all. Today, we are excited to host Maria Perez as our presenter for this 5th session in our Summit on Health Equity virtual series. Born and raised in Ecuador, Maria immigrated to the United States in the 1990s to pursue a BS in biology, a doctorate in Chinese medicine, and finally a master's in public health. She has crafted a career guided by her passion to address social disparities and is a seasoned nonprofit leader, organizer, facilitator, advocate, educator, and coalition builder. Maria is a firm believer in the power of people coming together to address complex social problems. She is a national expert on the issue of ranked choice voting and believes that democracy is the ultimate health equity indicator. In 2019, she founded the firm Democracy in Action, which works at the intersection of equity and democracy. You can read her complete bio on our website at nmhealthequity.org. Please welcome Maria Perez.
Hi, everybody. Thank you so much for joining today. Let me share my screen with you all. All right. And thank you, Suzanne, for the introduction. I'm excited to be here today. I am going to talk to you all about exactly that which Suzanne just mentioned today, how I believe that democracy is the ultimate health equity indicator. And I'll go over why I believe that in a moment. But before I really get started with this presentation, I would love to know who is in attendance today. And Suzanne, if you can help me get a read of the room, I'd like to know how many people on this webinar are working in the field as community health workers. Can you raise your hand if you are a community health worker?
And you all can raise your hand on the participant tab, but you can also put it in the chat window. So we have one person so far raising their hand. There may certainly be more.
Okay, how about social workers there working out in the field? Raise your hand if you're a social worker.
We have 3 attendees who have raised their hands for that.
Okay, perfect. How about how many of you all are involved in advocating for any sort of health policy or have been involved in advocating for any kind of health policy?
Lots of hands going up on that. I'm going to say over 10 at this point.
Okay. Perfect. Okay, so let's get started with this presentation. Again, my name is Maria Perez. I, by trade, by education, I, have a doctorate in Chinese medicine, and I also have a master's in public health. I started my career as a doctor of Chinese medicine, so really serving people, individuals, one-on-one sort of health access type of work. And my career has changed a lot since then. And that was, I started as a doctor of Chinese medicine in 1999. So I'll get to sort of like my career path here in a minute. Okay, what to expect today? Please be open, be curious, and I want to encourage you all to have upstream thinking. We'll get into what upstream thinking is for those of you who may not be familiar with the term, but basically think about the whys of things, right? Like if we have a health disparity, why is that? And it might be because, people don't have any money. Why is that? Because there's not enough jobs. Why is that, right? So like think upstream for any problem that arises that we talk about today, or for any sort of like policy that we talk about. Just keep asking those why questions. Be curious, ask questions. Like we mentioned before, you can ask questions throughout this whole presentation. I'll be stopping in sort of like strategic places to take a few of your questions if there are any. Be reflective, and by that I mean, this presentation, or in my work in general, really is bringing two things together, which is health equity and democracy, which are two things that are not that often thought about or talked about together in the way that they intersect. So just be aware of how you are receiving this information. If it's making you think of things in a way that you haven't before, if it's making you uncomfortable, if it's having any like aha type of moments for you, just sort of like sit with the way that you are receiving the information today. Okay, so upstream thinking is the backbone of public health. You all may be familiar with the old story about the river, right? There's a person just chilling, having a nice day by the river, and then all of a sudden they see that somebody's struggling in the water, halfway drowning, passing them by. So they panic, and what do? They jump in the water to save that person. They drag him out of the river, get him onto the shore and make sure that they're alive, that they're okay. And as they're doing this, they see two more people floating down, struggling to stay afloat. And this person leaves the person on the shore, jumps back into the water to save the two people. and drags them out to the shore, make sure that they're okay. And meanwhile, they see more and more people struggling, halfway drowning, passing them by in the water. So the question then is, do I keep on jumping into the water trying to save as many people as I can? Do I recruit a couple more people right around here to help me jump in the water and get the people, save the people who are drowning? Or do I walk upstream to see what is happening and why these people are in the water to begin with, right? And this is sort of like the premise of public health practice. Who keeps chucking these people, these kids in the river? Well, ultimately, it is our elected officials. It is our government. The government is in charge of making sure that people aren't chucked in the water or left to die out of neglect and lack of investment. So let's talk a little bit about this. The way that I think about democracy and health equity is really visually depicted in this slide. We live in a democracy, right? A representative democracy, which means that we elect public officials to take care of us, to find solutions for our problems, and to make sure that people are able to live and thrive and life and the pursuit of happiness and all those sort of things that are, you know, in our Declaration of Independence and our Constitution and all this sort of thing. This slide, these two pictures show you, it's very striking. On the left, you have voter turnout. The redder the image, this is by county, right, nationally. So the redder the counties, the worst outcome, so the lower voter turnout. This is from 2016. So you can see very clearly, right, like Alaska and sort of like Texas and in most of the South, with some exceptions, are, you know, we have very poor voter turnout. On the right, you have a life expectancy map, also by county. And same thing with this, the redder the areas, the worse the outcome. So it's strikingly similar, right? The counties that have very poor voter turnout outcomes are also the counties, for the most part, that have very poor life expectancy outcomes. Over the last decade, we have seen for the first time in our nearly a century that our life expectancy has begun to decline. So this is of concern to me, and it should be of concern to all of us. Public health has become increasingly tied to the health of our democracy, as is clearly depicted in this slide. So as you know, we think about how health outcomes and life expectancies are dropping, the rates are dropping in the last few years. We also see, connected to the slide on the left, how voter turnout is decreasing. Many state legislatures have taken a lot of measures and taken a lot of votes to make it harder for people to vote, to participate in elections at all levels. There's issues with extreme gerrymandering that happens mostly at the state level, restrictive election laws. And this has led to really biased, hyper-partisan legislatures that have mostly also taken votes and enacted policy that is not conducive to public health. So things like, you know, refusing to expand Medicaid, or you know, decreased regulation on things like water quality and things like unemployment laws and all kinds of laws that that have to do with people's ability to live a full and thriving life and to live to their full potential. So many studies have found that political disenfranchisement is associated with poor health outcomes. We are, like I mentioned, a representative democracy. We elect decision makers to represent us and to make decisions in our best interest, but governing bodies at all levels right now, and more over the last decade or so, have become way less responsive to the people and more responsive to wealthier, special interest, or just in general wealthier sections of the population. So in places, in all places, voter turnout usually is the highest among the wealthiest in the community. And people who have a lot of resources often vote against public health spending. It's not something that concerns them very much. So this, as you can see, sort of turns into a vicious cycle, right? Like restrictive election laws create a situation where most affected communities have the most barriers to casting a ballot. This leaves only the wealthiest people voting with ease, and wealthy people usually don't have that much in their interest to support public health measures that would help the folks who have been disenfranchised. And it goes on and on and on, making this problem worse as we go. Okay, so there is three things going on that affect the chart regarding voter turnout in the last slide. One of it is the cost of casting a vote, right? So we talked about this. There's many laws happening in many states about how to make it harder for people to cast a ballot. So we've seen there's voter registration restrictions in many places where you can't register to vote if you have been a felon, or if you don't have voter ID, or a number of other restrictions on that. There's voter list purges, which are very alarming. For example, many legislatures are considering dropping people from the voter roll. So let's say that you're a registered voter in your state, and you, for whatever reason, have decided that you didn't want to vote in the past 2 general elections. Many states are saying if people aren't voting, then they shouldn't be on the voter rolls. So they're purging people from the voter rolls for the reason that they haven't voted in the past couple of elections. Now, voting is a right. So this is very alarming. You have a right to vote or not to vote, but that right shouldn't be, people shouldn't be able to take it away from you because you've decided not to participate in a couple of elections. Many states have bans or restrictions on early voting, whereas people can only vote on election day. So this creates problems for people who work and can't take the time off, for people who have kids or elderly relatives that they need to care for. Early voting really allows for a lot more people to be able to cast their vote. Same thing with absentee voting. This has been a big topic recently because of COVID, right? Like many states have wanted to send an absentee ballot to every single registered voter so that they can cast a ballot without having to risk getting infected with COVID by showing up to a polling place. And there's many legal fights about this in many states right now where, certain interests feel like people should not just get an absentee voting, that they should have to fight really hard to get one. And if they want to vote, they should just risk everything and just show up to the polling place to vote. There's voting ID restrictions in some places. We have voting ID in some locations here in New Mexico. Felon disenfranchisement, which means if you have been convicted of a felony, then you can't vote again, ever, even after you've served your time and paid your price, um, which disenfranchises a large number of people because, you know, we have the largest percentage of incarcerated folks in the world. So all of those people serving time for felony convictions, then when they leave in many places, they still can't vote. And the issue of fewer voting machines in poorer precincts, we saw this big time last week, I think it was in Georgia, where more you know, wealthier neighborhoods have a lot more voting machines, and poorer neighborhoods have maybe just 1, 2, or 3 voting machines, and a couple of them don't even work at all. So this is another way of making it really, really difficult to cast a vote, right? The cost of casting a vote is very high for people, which of course reduces the number of votes that are cast. But that is just one part of it, right? The other part of it, outside of straight out voter suppression, that we need to consider about why voter turnout is so low and therefore health disparities are so high, is the value of the individual vote. Do people feel like their vote counts? How many times do you on this webinar, how many times have you gone to cast your vote and you felt that you have to sort of hold your nose and vote for somebody you don't really want to vote for, because if you actually vote for who you like, your vote is going to be wasted, and you might even help elect somebody who you don't like at all. How many times do you go to cast your vote and you see that there's only one person running, right? There's no competitiveness in our elections. Does that make you feel like your vote's counting if there's only one candidate? Like, why would you even show up to vote when there's no competition there? And the lack of competitiveness in elections is a problem that's getting worse and worse since 1970 nationally, but New Mexico is one of the worst states for this. Our lack of competitiveness in our state and local elections is a big problem. And what lack of competitiveness means is there's 3 factors to look at when we're talking about competitive elections. One is there an incumbent running? So somebody who's already serving that seat, is that person running again? And if so, do they have a primary challenger? Many times as an incumbent, you have the full backing of your party, whichever party it might be, and there is disincentive for other folks in your party to run as a primary opponent to you. People tell you to drop out. People tell you that you shouldn't be running against your own team, etc. So we have, is there an incumbent running? Is there a primary challenger to that incumbent? If so, and thirdly, once we get to the general election, is there somebody from the other party running? In New Mexico, those numbers are grim, right? Most incumbents run again, which is fine. Many of them run without a primary challenger, and many of them also run without an opponent from the other party. So basically this means in New Mexico that if you run and get elected to office, say like state house or Senate or whatever it may be, you're kind of comfortably sitting in that seat for a long, long time. It's very hard to unseat you. So when you as a voter go to the polls to cast your vote, a lot of times it feels as a voter that those elections have already been decided and that your vote doesn't count that much. So that also suppresses the vote. And then finally, it's the cost of eligibility for candidates. How easy it is to run. How easy is it to get on the ballot? It's not that easy, right? It requires, if you are with a major party and you have the support of your major party, then it's not that hard because you have a political machine and a fundraising machine to support you. But otherwise it's almost impossible. Requirements to get on the ballot for a third party or independent candidate makes it purposely impossible to get on the ballot. You have to have enough money to run on a primary election and a general election if you're from a major party, or just have an incredibly high number of signatures to qualify to get on the ballot, on the general election ballot, if you're an independent candidate. And then there's always as a candidate, the disincentive that I mentioned before, that if you want to run, which I think is the bravest thing anybody could do, is want to run and represent their people, their community. If you want to run, you are told that unless you have a machine, political machine behind you, you are told that you are likely to take precious votes from an actually viable candidate, and that you should just get out of the race and not run for office. So these are all problems that result in that low voter turnout, low civic engagement, and then it results in problems with the candidates that we actually end up electing. This all has to do with the way we elect our officials. Okay, so let's take a little break here and see if there's any comments or questions. Suzanne, can you help me out with that?
Sure, there have been a few comments. Annette was just agreeing all the time about, I think that was probably in reference to having to choose the lesser of two evils. And then Katie also mentioned that in this past primary, we unseated so many dinos.
Yes, so this past primary was a complete shift from the trajectory that we've been going since 1970, where there was like a big community led effort to find primary challengers to some of the senators that people were feeling had been there for way too long without competition in those elections. Most of those conservative Democratic senators that were defeated in the primary in the last couple of weeks had been there for decades in their seats without really ever facing much of a challenge. So, correct. This election shifted something in New Mexico, and I think that we are sort of seeing some shifts at the national level also, because people are beginning to wake up to these realities. Anything else? Do we have any questions from folks?
We had one more question from Jackie, who said, so there really isn't a good reason to vote, it sounds like, because the system is against us from the start.
Well, I wouldn't take it that far. There's always a good reason to vote, because that is the only thing that we have in a representative democracy. That is the only avenue that we have to shape our destiny. So definitely keep voting. But what I'm hoping to inspire you to do today is to think about how we elect people and how we may be able to make certain changes to the way we elect people to increase representation and mutual accountability between elected officials and community members. Okay, so let's move on. Let's talk about how we currently elect our officials. In New Mexico and in the whole country, really, the way that we elect people is called first past the post, which basically means anybody who has the most votes wins. So we have two candidates and one candidate gets 55% of the vote, the other candidate gets 45% of the vote, then we have a clear winner. The person with 55% of the vote got the majority, they win. That seems fair. But what if we have more than two candidates, right? Let's say we have a race with 5 candidates. I don't know how many of you on this call live in Congressional District 3. We just had a primary election last couple of weeks, right? Representative Ben Ray Lujan is running for Senate, unopposed in his primary. His seat was open, right? Representative Lujan has been in that seat as our congressional representative for many years, many elections, many cycles. And he's, going for a Senate seat, so his seat was open. We had a bunch of candidates for that seat. That became a competitive seat because the incumbent wasn't running. That has not been a competitive seat in all of the years that Representative Lujan has been there. There hasn't really been a robust competition for that seat. So we had a bunch of candidates for that seat. This isn't, these numbers aren't based on that race, but it, it well could be. So let's say hypothetically we have a race with 5 candidates. The winner is elected with 33% of the vote. The winner in a race with 5 candidates actually could be elected with less than 30% of the vote, right? Mathematically, they could have more votes than anybody else with 30% of the vote. That means for this case, somebody won with 33% of the vote. This means that 67% of the voters preferred somebody else. Does that seem democratic to y'all? The vast majority of the people preferred somebody else. So how is it that somebody with 33% of the vote can actually win a race? This is a serious question that we have to pose. There is no good reason why first past the post is the way we do things. The only reason really is because it protects incumbents and it sort of like gives more power to people who are already in power. But let's take a look at it a little bit deeper. Let's say that you're a candidate. Here on the left, we have a little chart, right? So like you're a candidate, you're running your campaign. So you know who your base of voters are. These are people who will volunteer for you. They'll donate to your campaign. They'll post stuff supporting you on social media. They might go knocking on people's doors or do mailers for you. You have their vote. It's absolutely certain these are your supporters. Excuse me. Then we have everybody else's voters, right? Every other candidate has their own base of voters. And in that case that we saw before, 33% of the voters are your voters. 67% of the voters are somebody else's voters, right? There's a tiny sliver of the population who is considered undecided. They haven't figured out whose base they're in, which candidate they love the most. In first past the post elections, what happens for all intents and purposes is that candidates don't talk to anybody else but those undecideds. Your voters are in the bag. You don't really need to talk to them. You may want to do like a little events for them once in a while or send them little thank you notes, but they're solid. They're your voters. You don't need to spend your resources of time and money and people power to keep them being your voters. They're yours. They're committed. Everybody else's voters are committed to somebody else. You don't, it's not smart to spend your money and your energy and your people power trying to convince those people that they should vote for you instead. So all candidates are preying on this tiny sliver of undecided voters because they are the ones who are gonna, who are often going to throw an election one way or another. So we have 5 candidates talking to maybe 5,000 people, right? Depending on the race. They're all targeting those 5,000 people and nobody's talking to the rest. So this also is not very democratic for a number of reasons. First of all, as you can see on the text part of this, current campaign logic results in a lack of engagement with voters. Candidates are not talking to the majority of voters. They're talking to a tiny sliver of the voting population. Because they're only talking to undecided voters for the most part, candidates are incentivized to engage in negative campaigning. In other words, I'm a candidate, I knock on your door and I tell you, you should vote for me because everybody else is a horrible candidate. And they've done this and that, and this one person, you know, you get into like negative attacks on a personal level, right? This one person didn't pay child support, or this one person got a DUI, or whatever it is, things that may speak to the character of other candidates, but doesn't really have anything to do with their platforms or their policy priorities or what they believe in, right? And the other thing is split votes. When you have a big field of candidates, it is likely that many of them are going to share similar policy priorities. You know, for example, in this CD3 race in northern New Mexico the other week, many of, you know, most of the candidates were in this district for that Democratic primary. They're fairly progressive. They're fairly progressive on issues of environmental, you know, green stuff, environmental stuff, immigration stuff. Most of the candidates sort of had similar platforms. And so they split the vote, right? Also, split vote happens when you have, you know, let's say that you have, in many places, particularly in the South, we see this, where in a community there'll be 4 African-American candidates and 1 Anglo candidate. Even though the community may have a majority of Black voters, that Black vote is split between the 4 African-American candidates, and this results in the white candidate winning, which, you know, considering that the majority of the population is not white, it becomes problematic in terms of representation. Once people are elected through a first past the post election system, what we have is that basically, if you get elected through this, you feel that you're only responsive to your base. You're accountable to your base. Those people who got you there are the people that you're going to represent, and everybody else is kind of like the other people. There's a lot of othering going on, and we see this really big at the national level right now, both in our federal government, but also in our you know, not only in the executive branch, but also in Congress, where folks say, you know, these are the people that elected me, and everybody else, I don't want to hear about their problems. They're not going to vote for me, so I'm not going to be accountable to them. There's also very little incentive to collaborate. Once you get elected, you know, you are not likely to work with all those opponents that you defeated, who you engage in negative campaigning about, even though the majority of the people actually preferred them, you know, all of them together than you as an individual. So there's no incentive to collaborate with folks, not just with like the losing candidates, but also with other people in your governing body. Everybody's just really out for themselves in first past the post. It's a zero-sum game. Basically, if I win, everybody else loses. And as a voter, I want my candidate to win, and I want everybody else to lose. This results in having, you know, being really, really difficult to pass good, bold policies. People are entrenched, people are polarized. They're not going to have a substantive conversation about policy solutions. They're just trying to please the folks who got them there. Not only the voters, but also special interests, of course. Big money is a part of this. And yeah, this is not working out that well for us. This creates political deadlock. This quote I got, Nick Saban. I have no idea who that person is because I'm not into sports, but apparently they're maybe like a football coach or something. But it's a great quote, right? You can't win together if you don't work together. Our elected officials, again, we live in a representative democracy. Their job is to represent us, all of them together, working together to represent all of us. So they are supposed to overcome their differences, their political differences, their personal differences and really roll up their sleeves and work to make sure that our communities are doing the best that they can. Suzanne, do we have any comments or questions at this point?
We do. I was actually going to step in if you didn't stop for a second. So I think, so Jackie, who had the comment about maybe it's not, there's not a good reason to vote, also clarified, so I'm going to read you her additional comment, but then I'll also read you Benny's questions and comments because I think they're kind of tied together. So Jackie had also said, but it seems like our democracy isn't representative and there maybe should be other ways to make change. And then Benny also says, so what is the incentive for taking the time, energy, and effort to vote? If voting suppression efforts are as effective as the presenter is saying, would one person's vote really make a difference? Or as the authors of the book Freakonomics make a strong case, the cost-benefit analysis for voting do not add up and voting is a waste of your time and effort. How can you make a strong case for voting when the barriers are built in and strongly entrenched in the electoral process?
Okay, so yes, your vote does count as an individual. We have seen races decided by, a couple of dozen votes. So, it is so important that everybody votes. I don't know if people are familiar, and I'm sorry I didn't include this in this presentation, but there's a visual that has like an illustration that has a shark and a bunch of little fish, like a school of fish together, right? And the shark is just eating up all the little fish, and the little fish are desperate, swimming around, trying to get away. And that's kind of like what this system is making us want to feel, right? This is kind of like what the people in power want us to feel, is that we are just powerless. We are swimming around in a sea of danger and we can just fend for ourselves and hope that somebody else gets eaten today. The other side of this visual is all the fish in the school of fish banding together and forming the shape of a very large fish together, and they are a power, they're a force to be contended with now. So there's something about banding together, working together. Each individual person, each individual vote is part of that greater good, that greater force. So please don't be despondent, and please show up to vote. And I'm going to show you some more things that I'm hoping is going to incentivize you to do this. Our vote is the only tool we have to make changes. So we just have to make sure that our vote counts and that our elected officials actually are accountable to us. If we give that up, we are living in a dictatorship or, monarchy. So if we care about our democracy, if we believe that democracy is by the people, for the people, and that it is based on political equality, we have to fight for it tooth and nail.
We do have a couple of other questions, but I'm going to let you go ahead and continue because I think you may address some of these other questions that are popping up as you continue on.
Okay. So who pays the price for political deadlock? It's our most vulnerable communities, right? There's this is at the national, state, but I want you all to sort of shift your thinking to the local level. Issues of homelessness or housing insecurity, the state of our parks and playgrounds, trails, green spaces, racial tensions and issues of police misconduct and brutality, and also, police training, who gets recruited to be police, can police officers live in the towns where they serve, etc. And then issues of wages and living wages and stuff like that. Most of these things do happen at the local level. And by local, I mean municipal level, right? Your cities. Who's making these decisions? Who gets elected to these governing bodies? And why can't they roll up their sleeves and work together on these issues? It's because of there is really almost zero incentive for them to do so. But what if, right? I've just spent the last several minutes bumming you all out, telling you about how horrible everything is. What if we could do it different? What if we had a political process that gave voters more choice and more power, that brought more people in to participate, incentivized civic engagement and voter participation? What if we had a political system that incentivized positive campaigning? Is that even a thing? What if it incentivized elected officials working in coalition with their opponents, with the people they defeated, with people on the other side of the political spectrum? What if we could have a system that welcomed diverse voices at the decision-making table and allowed for diverse candidates to run for office and maybe even have a chance to win? What if we ensure that elected officials have the support of the majority of the voters as opposed to just a plurality of the voters, which means first past the post? So there's different ways to doing this. This sounds pretty good, right? I would like to live in a place where there was a political process that included all of these things. So let's take a look at this. We can do this a different way. There is no silver bullet, but ranked choice voting is an important step towards improving the health of our democracy. Like Suzanne mentioned at the beginning, my work right now is on election reform and ranked choice voting specifically as a remedy. You know, we talked about my background as a healthcare provider. From that, you know, I turned to health policy because I was mostly treating patients who were uninsured or not fully insured. And I started really wondering why people were uninsured, why their insurance, people who did have insurance, why was it so difficult for them to navigate? Why was I seeing such bad health outcomes in folks who were working really hard but couldn't make enough money? I was a primary care practitioner in the state of Oregon at the time of the 2008 housing bubble collapse of the economy. And it was really interesting to me because I had a bunch of patients who were regulars who had jobs and had insurance, and all of a sudden they had no jobs and no insurance. And I could really see in real time how these things affected people and impacted people's health and people's families and the way that they were able to show up to their lives. And it was heartbreaking. So at that time, really, I decided, you know what, being a healthcare practitioner is wonderful and it's really rewarding, but I need to work on the whys, right? Upstream thinking. Why are these people uninsured? Why did the fact that they lose their jobs now mean that they don't have access to healthcare? You know, why is this single mother working 3 jobs and like her kids are still going hungry? So at that time, I sort of started shifting my career from a practitioner to an advocate and started doing work on health advocacy. And from there, as you know, I've worked on health policy and health equity campaigns and work for many years. And as the years have progressed, I just have come to the realization that all of this advocacy work that I have been engaged with, so working on access to healthcare services, fair wages, housing, transit justice, environmental justice, education, peace promotion, all of these things that I have been involved in advocating for tend to get stalled at that elected official level, right? If they're not interested, if they don't feel, if your elected official doesn't feel that they need to pay attention to you and the priorities of your community because they don't need you all to get elected, they have donations from this big special interest industry or whatever it is, and like a handful of really wealthy voters, they're not going to be responsive to your needs. So at that time, I really made the decision to work specifically on democracy and on election reform. I believe that if we can change the way we elect our officials to be more reflective of our communities, we will just have better health outcomes, and that's my work now. Okay, so that's the background of why I do this work. Ranked choice voting, I'm going to get into it a little bit. This is a picture of, I'm going to say Minnesota, I'm forgetting right now. I think it's a Minneapolis city council member going to vote with his whole family in a ranked choice voting election. If we can have a show of hands, how many people on this call are familiar to some degree with what ranked choice voting is? Raise your hand.
Looks like we have about a third of the attendees who have raised their hands.
Okay, perfect. So if you know about this stuff already, just humor me so that we can make sure that everybody is on the same page. Okay, so this is how it works. On the left, you have a ranked choice voting ballot. City of Santa Fe implemented ranked choice voting a couple years ago. And this was the sort of like the mock sample ballot that we used in a voter education effort here. Clearly, these are not real candidates, but we use them to take politics and like all the strong feelings and emotions that come up for people when they are talking about real candidates. We decided, let's talk about animals and explain it this way. So basically in a ranked choice election, you get a ballot that lists the name of the candidates, as you see there on the left-hand side column. All the candidates that are running for a seat are listed, and then you get to rank them in order of preference. So this voter on this ballot, their favorite candidate, the candidate they love, the candidate that they actually donated money to, was Lucinda Lizard. They just love Lucinda Lizard. They maybe went to school with Lucinda Lizard, they know Lucinda Lizard, and they trust Lucinda Lizard. So that's their first choice. However, if Lucinda Lizard, for whatever reason, doesn't have enough popular support to win, what a ranked choice ballot does is that it allows you to mark your backup choices in case your favorite can't win. So this voter loves Lucinda Lizard, but they like Diego Deer pretty well. And they feel okay about Betty Bear, and they would rather have Roberta Rabbit win better than Felix the Fox. They just really don't like Felix the Fox. So a ranked choice ballot allows you to, in a more nuanced way, right? Remember, it's not a zero-sum game anymore. This is not something where I'm thinking as a voter, I want Lucinda to win and everybody else to lose. This is allows you to have a more nuanced opinion of who's on the ballot and how you would like things to pan out in the end. If my favorite candidate can't win, I want my second favorite candidate to have a chance. Okay, so this is how you do this. This is how your ballot looks like, and this is how you interact with it. This is how the voting counts. The voters' preferences get counted. So this is a different example here for simplicity. In this example, we only have 3 candidates. It's ice cream flavors, right? Chocolate, vanilla, or strawberry. Once everybody has filled out their ballot, what the machines do is that they look at everybody's first choice and only their first choice. So basically, the machines are just counting everybody's favorite candidate. If a candidate wins the majority of the vote, of the first choice vote, then that candidate wins. They win the majority and they're done. That's all the threshold is to win 50% plus 1 of the vote. In this case, we see that none of the candidates actually reach that 50% plus 1 threshold. We do have a favorite, which is chocolate. 40% of the people love chocolate, but it didn't quite put him over the winning threshold. Now, mind you, in a first past the post election, chocolate would have won, right, with 40% of the vote. So what happens if no candidate wins with first choice votes alone, then the candidate with the least number of votes, so the least popular candidate on first choice votes, they get eliminated. And those voters who chose them as their favorite candidate then have their vote count for their second choice. So in this case, vanilla was the least popular candidate, got the least number of first choice votes. So we're gonna eliminate vanilla. And if you as a voter loved vanilla and that was your favorite candidate, now your ballot will count for your next choice. So if you love vanilla first, but then you like chocolate second, then your vote's gonna count for chocolate. So it's kind of like a runoff election, but you mark your backup choices without having to go back to the polls again and without having to narrow it down to just 2 candidates. After that, we eliminate vanilla. We reallocate those voters who loved vanilla the best. We reallocate their votes to their second choice. And we see that chocolate actually is the winner after all with 55% of the vote. And strawberry came in second with 45% of the vote. So even though chocolate would have won with 40% of the vote on a first past the post system, here we have chocolate winning with 55% of the vote. So their mandate is strong. And as a voter, if I preferred vanilla, I still feel like my vote counted, and I am happy to have chocolate win because they were my second choice. I have to tell you that in the Santa Fe election, the ranked choice election that we had 5 candidates run for mayor. I marked my ballot. My first choice was eliminated. My second choice was eliminated after rounds of counting. And my third choice actually was the person who got elected mayor. So they weren't, my favorite candidate, but as a voter, in the end, I was happy and I felt like, yay, my candidate won, even though they were my third choice. So this, it's just a different way of doing business. And as a voter, you never have to feel, I'm not gonna vote for chocolate, I'm not gonna vote for vanilla because chocolate's gonna win anyways, right? Do we have any questions about the tabulation piece of it? That, can be a little confusing for folks because it involves math.
I don't know if we have any specific questions. Annette did say that there are ways to change the system as we are seeing demonstrated right now. You can advocate with your current elected, and with your party to promote new policies. Of course, I always promote running for office yourself to change the system.
Yes, absolutely. Okay, so ranked choice voting, how does this change doing things this way? You'll remember that chart that I showed you before that had on a first past the post election, your voters, everybody else's voters, and the undecided voters. When you're running under ranked choice voting, this changes completely because in a crowded race with more than 3 candidates, it is basically not that plausible that you're gonna win with just first choice votes. You're gonna have to get some people to rank you as their second choice and some people to rank you as your third choice in order to be able to win that majority of the vote. So as a candidate, you talk to every single voter, and this is very important. Big reason why people don't turn out to vote is because they don't even know there's an election, because nobody has talked to them about any of the candidates, because they don't know the candidates, they don't know what the candidates stand for. They don't know the difference between one candidate and the next. People say, oh, well, I don't know anything about this, I'm not gonna show up to vote. With ranked choice voting as a candidate, you wanna talk to all the voters. You wanna make sure that your base stays your base. And more important than that, you wanna make sure that folks who may prefer you as their second choice actually mark you as their second choice on their ballot, right? So as a candidate in first past the post type election, if I'm knocking on doors and I see that your house has a yard sign for my opponent, I'm not even gonna knock on your door. I know that you prefer my opponent. I'm not gonna waste my resources on talking to you about it. On a ranked choice voting election, if I see my opponent's yard sign on your lawn, I am absolutely going to go knock on your door and I'm going to say, hey, I am so and so, I'm running for this office. I see that you like one of my opponents in this race. Can I ask you why you like them? What kind of policies do they prioritize that are important to you? What's important to you? And then you get in a conversation with them, right? So they may say, well, you know what, I'm a teacher, and this person that I prefer is my favorite candidate. They also are a teacher and they've worked on issues that are important to me that way. Then that's your opportunity for you to, instead of talk negatively about your opponent, to say, you know what, my opponent and I have actually worked together on A, B, and C, and you know, I care very much about issues concerning teachers and public education. As a matter of fact, I was on the school board, whatever, right? So instead of attacking your opponent and hoping to convince this person to change their mind as on who they're going to vote, you're trying to connect with them, find out what's important to them, why they prefer somebody else, and then convince them that they should have you as their backup choice in case their candidate can't win. It changes everything. It changes the tenor of the conversation. It makes so that conversations that are had by campaigns and voters are about policy and not about personal stuff. It definitely increases civic engagement because more voters are being touched by campaigns, are being talked to, are being reached out to. And it also allows for diverse and non-traditional candidates to actually show up and decide to run for office, even if it's going to be a hard push for them. Let's say that I'm a community health worker in my community, and I'm just sick and tired of seeing the same problems never addressed. I work closely with my community. I see there's a food desert in my community. The young kids' rate of type 1 diabetes is super high. I decide I want to run for office. I don't have a political machine backing me up, right? I'm just like a concerned community advocate, and I want to throw my hat in this race. With ranked choice voting, nobody's going to tell you, you better drop out because you're going to take so few votes, but that vote that you're going to steal from some other candidate is going to make the bad candidate get elected. This never happens with ranked choice voting because even if you can't win, those voters who like what you're talking about, what you're bringing to the table, can still vote for you. Your voice can still be part of the table. Nothing gets silenced. And if you don't have enough popular support to win, all those voters who love you have marked who their backup preference is, and so their vote is still going to count. Once people get elected with ranked choice voting, then you're accountable not just to your base, but to those people who marked you as their second choice and their third choice, right? You're actually accountable to the broad majority of the voters. And also because of this way of campaigning where you're not attacking your opponents, but actually trying to find places of connection or of policy agreement with your opponents, then once you get elected, you can actually work with folks who you were running against before. So it incentivizes coalition work. So even if I get elected and 5 other people lose, I can appoint those 5 people to a task force to look at whatever it is that the community wants to look at, and we can all work together. Okay, this is a really cool thing about ranked choice voting. We were talking about yard signs, right? So these are different ranked choice voting elections in different parts of the county, but you can see here on the top right, somebody's lawn, and they actually like 4 candidates. Like, they like them enough that they are going to put a yard sign for 4 of them there, you know? It's remarkable. On the top left, you have for Twin Cities, for Minneapolis and St. Paul, that has ranked choice voting also. Endorsements also, so organizations that do endorsements of candidates with ranked choice voting, they say, we endorse these 2 candidates as opposed to just 1, right? There's a slate of 5 or 6 candidates. We think that these 2 would be really good. Either one of them would be awesome. Down here on the lower left, we have these Mark Lino and Jane Kim. They were both running for mayor of San Francisco. And they decided to just basically run as a platform together. So they're opponents, but basically they ran their campaign together. So it was like, vote for me first and for them too, number two. And the other person would say the same thing, vote for me number one and for him number two. They had very similar platforms. They didn't want to split the vote, right? So they were trying to form a coalition together, even as they're campaigning. And you see the same sort of thing on the bottom right, where there's two candidates who are running against each other. In this case, you know, they're both Asian American candidates. They're both women. So this is the kind of thing, this is in St. Paul, Minnesota, where votes get split, right? When you have people of a minority community, maybe like women candidates, like these are the kind of candidates that often in a first past the post system split the vote. Here they can actually run opposing each other, but in coalition, and making sure that you know that you're not gonna split the vote if you vote for one over the other. Okay, let's talk a little bit about the benefits of ranked choice voting. So here's just some random data. You know, ranked choice voting has been going on in this country for almost 100 years. The place where it started and where it first got implemented was Cambridge, Massachusetts, and they've had ranked choice voting this whole time. But it really hasn't caught on up until the last 20 years or so. So there's some data. We have decent data for the past 20 years and getting more and more as more cities and states implement ranked choice voting. So up here on top, top left, we can look at voter turnout. So the blue lines is before ranked choice voting got implemented, and then the purple line is after ranked choice voting got implemented. So Oakland had a little dip in 2014, and it went up again in 2018. But for the most part, you can see that ranked choice voting slowly but surely increases voter turnout in places that have it. In Santa Fe, we saw a 10% increase in voter turnout on our first ranked choice voting election. We can't say that it's only because of ranked choice voting. There's many factors that impact how many people turn out to vote, including, you know, is it an open election, or is there an incumbent running? Are there other issues on the ballot that are important to people? But it seems to be a trend that places that have ranked choice voting see increase in voter turnout as election cycles go on. On the bottom, we can see some data about, this is from the 4 Bay Area cities that use ranked choice voting, and those are San Francisco, San Leandro, Oakland, and Berkeley. We can see changes in diversity in governing bodies, right? So at the top you have, before RCV, we had 62% of elected officials were white, 18% were Black, 7% were Latino, and 13% were Asian. And there was like nobody else from any other ethnicity elected to any of these 4 Bay Area cities. After ranked choice voting, you see a shift that that reflects the actual demographic of those places way closer than we see pre-ranked choice voting. So after ranked choice voting, right now we have 39% of the elected officials there are white, 16 are Black, 21% are Latino, 19% are Asian American, and you know, there's like a little sliver of other folks from other ethnicities, so that way more represents the diversity in these communities. Here's just for a visual aid for you also, Minneapolis City Council. Minneapolis adopted ranked choice voting in 2010 was their first election. Before ranked choice voting, you see this picture here. There is one person on the city council, on the governing body, that wasn't white. And so 93% of the governing body before ranked choice voting was white in Minneapolis. Today, the Minneapolis City Council has one of the most diverse governing bodies in the nation. It almost exactly matches the demographics of the city. Interestingly enough, we have the first Hmong elected official in this governing body. We also have two trans people of color elected to city council. This clearly would have not happened without ranked choice voting if you look at the picture to the left. So, whatever your thoughts are on, gender identity or electing people of color or whatever it is something to be in awe of, that changing an election system results in having a governing body really directly represent the demographics of the place that they represent. At the bottom, you have Las Cruces City Council. So Las Cruces adopted ranked choice voting at their last municipal election, which was last year. And there was, just with one election, we saw a pretty significant change. So before ranked choice voting, the picture to the left, we had 43% of the council was white, 71% of the council was over 45 years old, and 71% of the council was male. Now, Las Cruces is, majority Latino and majority under 45. So this was really not representative of the demographics. Even though, in terms of policy, it wasn't a bad council. Today, we have a council that is 71% Latino and only 43% over 45. And we have a majority female council also. So this council, just with one election cycle, was, very much changed the racial demographics, also became much, much younger and in the majority female. So it's kind of amazing. In Santa Fe also, we had our first ranked choice voting election and our second round of the ranked choice voting election. And we, for the first time in the history of the Santa Fe City Council, we have a majority female governing body as well. This all leads to political breakthrough, where people actually have to work together across different lines of, political alliances and policy priorities, different kind of priorities according to the people they represent, right? Like in a city council that has 90% white representation, but 50% of the population is not white, those folks are not really being represented. There's just a disconnect between the community and the elected officials. So political breakthrough happens with ranked choice voting, and who benefits are vulnerable communities. People, parks and investment in green spaces happens in a more productive way in places with ranked choice voting. There's better housing policy, there's more investment in youth programming, there's tend to be more emphasis on community policing and having conversations between the community and the police, which is key right now. I think we're seeing in the state of affairs that we're going through nationally, that would be very good if there was open conversation between community members and the police department. I want to give you some quick examples and then open it up to questions. So Maine, oh wait, sorry about the typo there. Maine is the only state in the United States where they use ranked choice voting for all of their elections. So at all levels, all their congressional delegation is elected through ranked choice voting. Their state house and state senate stuff is elected through ranked choice voting. Their governor, all of their people are elected through ranked choice voting. And what happened in Maine once they adopted ranked choice voting at the state level was that Medicaid expansion happened. And that was something that people had been fighting for for years and years and years since Medicaid expansion became an option in 2010, I believe. And they just couldn't do it because of this political gridlock. And once ranked choice voting happened, people had to give a little bit and you know, actually work together, do that thing that is politics, right? You state your priorities and somebody else states their priorities, and you figure out how to work it so that people can pass legislation that is important to them. So Maine, through ranked choice voting, in my opinion, it was because of ranked choice voting, we're able to expand Medicaid. In Minneapolis, you know, they've been having a hell of a time lately because of the George Floyd killing. And we'll talk a little bit about that. But basically, once they shifted to ranked choice voting, conversation that had been stuck in their governing body for years and years and years regarding minimum wage was able to move. So instead of having a minimum wage where people still couldn't afford to live in that city, they changed to having a living wage where now people are actually making as much money as it takes to be able to afford housing, et cetera. And another thing that that governing body was able to pass as far as sort of like community health policy was they now have a paid sick leave ordinance. In San Francisco, just very recently, because of ranked choice voting, they elected a new district attorney there, Chesa Borin, and he has worked with the ranked choice voting elected mayor and the board of supervisors, and they've been able to close down juvenile hall, which is a big deal and something also that they hadn't been able to do before. And they've ended cash bail as well. So big changes in sort of like criminal justice reform in San Francisco. Briefly, in New Mexico state law now allows for any municipality to have ranked choice voting. It is not available for us at the state level. There has been some legislation that hasn't passed yet that talks about being able to have ranked choice voting, for example, for our party primaries. It would be a great change for that. And also, I think for presidential primaries, because then we don't have to worry about having like a, you know, like a libertarian candidate splitting the vote or a Green Party candidate splitting the vote. But that is not the case yet at the state level. But at the municipal level, any city that wants to do ranked choice voting can do ranked choice voting. So it's just a matter of political will and advocacy at the ground. As of now, like I mentioned, just Santa Fe and Las Cruces have opted for this election reform. Albuquerque had this for a vote last year, and they, the governing body decided that they didn't want to do it. There's an opportunity to do it in Albuquerque. As an aside, Albuquerque spent $1.4 million on their runoff election this last year, which would have been saved had they had ranked choice voting, because ranked choice voting includes a runoff election in just one ballot, one trip to the polls. So you don't have to spend $1.4 million on a whole separate election 40 days after the first one. So since adopting ranked choice voting, both governing bodies in Santa Fe and Las Cruces are younger, they're more diverse, and they have more gender parity and are making better policy decisions, are more accountable to their constituents. Okay, so I'm gonna stop there and allow a little bit of time for questions.
Okay, thanks so much. So Siri has a question. Has research been done as to whether low literacy, et cetera, has a negative impact on people being able to vote well within this method?
There have studies in, or not studies rather, but like analysis of voter data in places that have ranked choice voting have shown that there are less mistakes made on a ranked ballot than there were before a ranked ballot. A really interesting example of that was in the last election in San Francisco for mayor, because the mayor of San Francisco, Ed Lee, passed away unexpectedly. So they had to call for an election for mayor there, and it was included in the same ballot with a lot of other races, including governor and races that don't have ranked choice voting in California. So the number of mistakes that were made by voters that resulted in a ballot not being able to be counted on the ranked choice mayoral election was less than 1%, and it was less than the number of mistakes that were made on the ballot for governor that just had, you know, vote for one and everybody, and that's it. So what we're learning from voter data is that people find a ranked ballot really intuitive. We rank stuff all the time, right? Like what restaurant we're gonna go to, or like what item from the menu we're gonna eat, or what movie we're gonna see. People rank stuff all the time, and that is across you know, races and classes and ages and all that stuff. Basically, if you can count to 5 or 3 or whatever it is, that number of candidates on your ballot, you can do it. That doesn't really answer your question directly in terms of literacy, because we know that poor health outcomes turn to lower voter turnout, turns to poor health outcomes, right? So literacy is one of those indicators where people who are illiterate or have limited literacy turn out to vote way less than people who are literate. So that's a health equity that we need to address. But in general, across class, across education level, people who do vote make less mistakes on a ranked ballot than they do on a regular ballot or on a traditional ballot.
Okay, thank you. And then Jackie, who had some of the questions and comments earlier, said, ranked choice voting sounds like a step in the right direction. Can you give some examples or data of a direct correlation between ranked choice voting and the outcomes that you've shared?
So this is a hard thing to have a relayed correlation to, because for one thing, you know, the kind of health policies that really result in better health outcomes are the health policies that deal with preventative care, right? Preventative interventions and access to preventative care. And, you know, so like if we provide better housing securities, then we get better health outcomes, but it's hard to directly tie that to how we elected people, right? But we can tie that to who got elected. And we can see that in some of the examples that I gave you. We have governing bodies that are stuck, unable to pass any legislation forever because they're political gridlock. And then all of a sudden, you make whatever changes it is. It could be ranked choice voting. It could be changes with redistricting. It could be changes with, you know, taking away some of those barriers to voting that we talked about before. All of a sudden, you get people from the community that represent the community, even a couple of them elected to that gridlocked governing body. And then all of a sudden, policy starts to move, laws start to get voted in. So it's really difficult to directly correlate, but in doing the work that I do, it's just so clear to me that when you elect people that actually represent the community, you get good policy passed.
Okay. Annette is asking a question. She says, what are the most common difficulties in establishing ranked choice systems? And how long does it take on average for voters to adjust or polls to show that it is widely liked?
So to answer the first part of your question, the most difficult thing in passing ranked choice voting, adopting ranked choice voting, is elected officials, right? People who got elected through a different method. So if I'm a mayor of a city and I got elected with 33% of the vote through a first past the post, like that was the right system. It got me elected. I don't need to change that, right? So politicians, elected officials feel that whatever method got them elected is the right method. That is the main barrier, is to sort of like talk to elected officials into thinking about not what's best for them, but what's best for their community. And if they're a good candidate, they'll still be elected through ranked choice voting. It's not going to be It doesn't have to be an existential threat to you, right? You just need to change the way you campaign, and you need to, if you're not representative of your community to begin with, you have no place in being there. But that's the main barrier. People usually like it, like activists and engaged citizens. Usually once you start talking about these things, they're like, yeah, that makes sense. Let's change the way we elect people so we can elect better people. Like that's a no-brainer for people. In terms of the second part of your question, so places that have ranked choice voting, and right now it's about 15 cities that do ranked choice voting in the country, plus the state of Maine. State of Massachusetts is putting it on the ballot to do statewide elections through ranked choice voting. Same thing with Alaska. There's a bunch of other cities advocating for it, and there's about 12 more that are going to be implementing in the next year or so. So this is a growing thing, right? Every time that there's a ranked choice voting election, we people working on this in the field, we try to make sure that there's an exit poll conducted that gauges voter satisfaction with the system, right? So we ask, had you heard about ranked choice voting? Had you learned about ranked choice voting before you cast your vote today? Do you feel that your vote counted? Would you like to keep this system for future elections? And overwhelmingly, in places where we've done exit polling around this, the answers to that is like, yes, absolutely. That felt great. Like I feel, people don't feel like, again, that they have to hold their nose. They can actually go and vote for who they want, and they don't have to worry about feeling like their vote's going to be wasted. And overwhelmingly, people say that they want to keep it. And by overwhelmingly, I mean, like, I think in Santa Fe, 91% of the polled voters, and there was 1,300 people polled, so it was a big sample, said that they were either satisfied or extremely satisfied with the new voting method. So 91%, right? It's a lot. So people like it. Overall, people like it. People participate. You can see that in voter turnout. Very few people are confused to the extent that they make a mistake on their ballot. Yeah, I mean, data is looking good. Again, we only have about 20 years worth of data for some cities, and only a couple of election cycles worth of data in many of the cities that are now using ranked choice voting.
Leslie has asked, what actions can we take to advocate for RCV in Albuquerque?
There's an organization, Common Cause New Mexico, and I was working with Common Cause New Mexico when this was happening in Albuquerque last year. They're taking the lead on this. So I would contact Common Cause New Mexico, but also contact your city council members and the mayor and your city clerk. For Albuquerque, it really is a no-brainer because, Albuquerque does not have first past the post. Albuquerque has already, at the municipal level, runoff election system. So if a candidate doesn't receive 50% plus one of the vote on the first round, then the top two vote getters go to a runoff election about 40 to 60 days after the original election. Like I mentioned, that election cost Albuquerque taxpayers $1.4 million last year, and that was for 2 council races. So it wasn't even for like a mayoral race. It was like for a tiny sliver of the population that had to actually show up for that second round of voting. $1.4 million that could have well be spent on a number of other things in Albuquerque, right? The other thing about Albuquerque is not only the money, but because elections now happen in November, if there is a runoff, that runoff election is going to basically happen during the Christmas break, which depresses voter turnout even more. So if, in Albuquerque, something like 20% of the voters show up for the first round of elections, maybe 11% of the voters show up for the second round. And if it's during Christmas break, it's going to be even less. So there's incentive for Albuquerque to do it. Additionally to the $1.4 million of savings, the state of New Mexico pays for the first round of elections in New Mexico, in Albuquerque, but it doesn't pay for the second round, right? So this is the incentive that the state has for municipalities to adopt ranked choice voting. The state pays for your election. If you choose to have a runoff election, you have to pay for it out of your own municipal budget. So, I mean, please advocate for Albuquerque because it's just a travesty that they're not using ranked choice voting.
I think finally, we have just a couple of additional comments. Holly says, Maria, this has been an amazing presentation discussion. Thank you so much. She would like to have your email again, so I will make sure that we get that posted along with this recording on our nmhealthequity.org website. And then Annette says, Maria, your unabashed honesty is a breath of fresh air. Thank you so much for your words and your work. And I know there were a couple of other questions that were kind of in and out, and so hopefully your questions got answered, but I'm sure Maria would be happy to email with you if you had some other additional questions.
Yes, please share my email with everybody. I absolutely am very good about emailing you back. If you reach out to me, I'd be happy to talk to any of you about any of this. And thank you so much for your kind words. This is not usually what you hear in a public health or health equity summit. So I am honored that you guys were open to hearing about sort of like political stuff and electoral stuff, and that you shared your time with me. Thank you all so much.
Thanks so much, Maria. And I know we're at the 101 mark, but I do want to say thank you for your time, and we appreciate all of your efforts towards helping us create equitable New Mexico. And thank you to everyone who joined us today. We look forward to seeing you back next week for our final presentation as Dora Wang presents Pandemic Inequities. Thanks so much, everyone. Have a great afternoon.